supply is saved by vaccines as well. I mean, again, I want to know the truth. Just real quick, I've got a couple other charts I want to put up there. This is a chart a lot of people produced.
Chairman, if I could just interrupt for 10 seconds over here.
Sure.
Is today's just a point of order? Are we talking about vaccines or are we talking about the COVID vaccine?
Well, specifically, we were talking about the hiding of the safety signal on myocarditis.
So we're not talking about all vaccines.
We can talk about anything you want to. I mean, again, it has obviously opened up because we're also talking about the corruption of science. And I think science has been corrupted. So fair game. So and again, I appreciate you staying here and stick around and ask a lot of questions. I think you'll learn an awful lot.
Senator Johnson, that's my guy.
I'll take whatever I want. This is a chart. Again, I was looking at the VAERS. You know, I had been.
Mr. Chairman, that's not the way I ran this subcommittee.
This is a different. Again, I'll be very generous. Okay. I was actually instructed as a non-doctor what the COVID injections were. Encapsulated in lipid nanoparticle that was designed to permeate difficult to permeate barriers. So they lied to us when they said they'd stay in the arm. They knew it wouldn't. They had a study. The Japanese regulators uncovered that when they did do a biodistribution study in rats, it distributed all over the body.
Rats.
So that was the first lie. Didn't really talk too much about the toxicity yet of the lipid nanoparticle, but it goes all over the body. So I was aware, and again, that this was not a standard vaccine. This isn't a attenuated or dead virus that the body reacts to. This actually hijacks the cell, has the cell produce the spike protein, which is toxic to the body, which means the body attacks. Again, I'm a layman, but it's pretty simple for me to understand this. So I was aware of this like in October. So I'm watching VAERS, and so I'm publishing these charts, and I'm being censored. I see the next chart number 2. This is the full history of VAERS and the number of deaths being reported associated with the vaccine. You got a couple hundred a year until 2021, and yikes, 21,725 deaths worldwide. Why? And everybody's saying, "No, this is safe and effective." The vaccine injured were being gaslit. They weren't being treated. They're still being gaslit. There is no, by the way, there is no compassion, Governor. I could fill this room with photos of people who are dead because of the COVID injection. I could fill the room. And that is being denied. I could fill this room with photos of people who are dead because of the COVID injection.
From what?
I could fill. They're still being gaslit. There is no, by the way, there is no compassion, Governor. I could fill this room with photos of people who are dead because of the COVID injection. I could fill the room. And that is being denied. It is being denied. And these people haven't been able to get help. I held an event in Milwaukee in June 2019 and 2021, and all the vaccine injured, those women, all they wanted was to be seen and heard and believed, and they are not to this day. Okay? So again, they're not the ones politicizing. They just want to be helped. They want compassionate doctors to treat them, to recognize what caused their illness, not gaslight and not deny that it exists. But anyway, so you take a look at this chart, and they're still denying that this, nothing to see here. This is safe and this is effective. Okay? Next chart. This is the current VAERS chart. 38,607 deaths reported worldwide associated with the COVID injection. And we know VAERS dramatically understates.
When customers understand.
By a factor of 10, 100, we know it understates it. 9,228 of those deaths are occurring on the day of vaccination, the 1 or 2 days. Okay, I know VAERS doesn't prove causation, but man, that's a correlation we should have been looking at, but they ignored and they censored.
Facts.
But enough of that. Dr. McCullough, please, in my layman's terms, I just kind of laid out the harmful mechanisms of this injection. Can you and Dr. Vaughn, because I think you've both spoken to this, again, in layman's terms, talk about why this caused so much harm in so many different ways because of the biodistribution. Dr. McCullough.
80% of Americans took a vaccine. 20% didn't.
Right.
20% did not take a vaccine.
Facts.
The vaccine was never safe enough for me to take.
Facts.
Messenger RNA devised by Pfizer and Moderna has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood.
Wow.
It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. And we saw a poster behind Senator Blumenthal making a false drug claim that vaccines saved millions of lives, specifically the COVID vaccine. Well, let's take a look at that. When someone signs consent for a vaccine, Senator Blumenthal, does the consent form say it's going to save their lives? Of course it doesn't.
No.
It's not on the FAQ. There's never been a prospective, randomized, double-blind, placebo-controlled trial ever showing that COVID-19 vaccines reduce mortality or hospitalization. There's not even a valid non-randomized study. Thankfully, COVID mortality went down for 3 reasons. Because we all got the infection, vaccinated and unvaccinated, so we developed population natural immunity. We developed early treatment. Credit to Operation Warp Speed. We used all the Operation Warp Speed tools, additional drugs. We treated patients with multi-drug protocols at home so they don't go to the ER. So Governor Green never saw the patients we treated because they were successfully treated at home. And the third reason is the virus mutated to a much milder form. Those things happen concurrently with rollout of the vaccine. The vaccine cannot be falsely credited with saving millions of lives. We can't allow false drug advertising to be put up on a poster behind one of our public servants. We cannot accept that.
So let me quick.
See, man,
And I will have a lot more.
heathens.
I will have a lot more questions. Put up my that optional chart number 4 here, because I think this is something I developed September 2021, and this shows the number of daily cases of COVID, and you see it's peaking in January. Right as we're rolling out the vaccine, but we really haven't injected it with anybody. If by the time we had any kind of significant uptake of the vaccines, we were way down in terms of the number of daily cases. I mean, this virus was burning itself out. Okay, now we had different variants. Again, I've read a lot of information about vaccination into the midst of a pandemic driving variants. Is that what happened? I don't know. But you would think if a vaccine were that effective, the tail would just continue and the pandemic would be over. But that's not what happened. We had a whole new surge, and this is Delta, and doctors I've talked to, a very deadly, probably a more deadly. Would you agree with that, Dr. McCullough? Delta was a more deadly. I know you guys are kind of freaking out that your early treatment wasn't working as well.
It was definitely more difficult to treat. But fortunately, by that time, we had treatments.
But anyway, I just wanted to put this thing up here again. To a layman, if the vaccine really worked, was that efficacious, to prevent all that disease? By the way, they all admitted that it didn't prevent transmission. They lied to us about that for 4 months, maybe a year. Then they finally had to admit it didn't prevent transmission. But again, this chart right here just shows you that if the vaccine really would have worked, you wouldn't have had this. You would have had this. But I'll turn it over to Senator Blumenthal.
And I think we'll try to certainly stay within our 7 minutes so our colleagues can have their
See where this information coming from, heathens.
questioning.
But again, we'll have second, third, fourth rounds. I mean, this
See where this information
we'll use up
coming
time
from,
this
heathens.
year.
Not your own people's, is it?
The debate here seems to be about the efficacy of COVID-19.
Because they didn't know about
But
COVID-19.
the central issue that brings us here
Fucking
today is the
heathens.
allegation that there was purposeful
Selling niggas
concealment
out to line up and take an
of
experiment.
knowledge and evidence.
And we got the
And
facts right here.
I just want to make the point. I may be sounding
Make
a
the
little bit
point.
like a
Make
lawyer,
the
not a
point.
physician, but purposeful concealment, intentional hiding
intentional hiding
is essentially
crime,
undocumented
goddammit.
by the evidence released by this report itself. In fact, the documents released by the majority today show that public health officials took
Niggas out there
multiple
selling
steps in
niggas
the
out to
spring
take
of
an experiment.
2021
They had no
to make
clue
healthcare providers
of
aware
this shit, man.
of those rare,
Motherfuckers
they
was
were
reading
rare
from the script,
reports
getting
of
crumbs off the plate to
myocarditis
sell niggas out,
among
like I
vaccine
said.
recipients. On May 14, almost 2 weeks before the CDC decided to issue clinical considerations rather than a on
Force people to go out there
myocarditis,
and take an experiment. That's what they did.
which is, by the way, the primary piece of evidence that the majority cites in this so-called cover-up. The CDC's National
Straight
Center
cover-up.
of Immunization and Respiratory Disease sent an email to state and local health departments around the country entitled,
Y'all hear this?
quote, monitoring reports of myocarditis. End quote.
Myocarditis.
The email noted risks and contained a reminder that providers were obligated to report cases.
But did they?
5 days later,
Well,
they sent out a follow-up email urging recipients to let providers in their region know of risks and reminding them once again of the obligation to report cases. I have 2 emails here that are in the majority report. They're available to the public. I ask that they be made a part of the record, Mr. Chairman.
Objection?
Yeah, the report is there, y'all. Y'all can get the report. For those who want to get the report, we're just doing a little tapping in to some information. Y'all can get the report. Most definitely, the letter was sent out. Hold on, y'all. It's another joint they sent out. There's warning motherfuckers about that. Myocarditis, this right here. Blood clots, all types of shit. Strokes. All types of shit. Damn. Y'all need to see this. Biden officials knew of deadly COVID vax health risks. Did not warn public. Damn. Y'all can probably get this report too. Clear it up, clear it up. Come on, we ain't got time for that. Clear that shit up. Wow. Man, they really experimented on the peoples. Wow. What the facts talking about here?
Is that love for you or hate?
Oh, I say it again. You've been had. You've been took. You've been hoodwinked.